Teresa. Good morning. How are
Delia,
you?
it's so good to see you. I'm so
Good
excited
to
about your
see
class
you.
today.
Oh my God, I am so pumped up. Hey, how many people do you have registered for the class?
I think we have 18.
Oh my God, that is
Yeah.
awesome. I am super excited. So Teresa, before we go to the classroom, I just had a couple of questions, if you don't
Sure,
mind me
yeah.
asking, and kind of picking your brain a little bit.
Mm-hmm.
We saw Dr. Helmer a couple weeks ago, and he said there was no fever here in the Neuro ICU.
Oh, yeah.
And so Janice looked at us and she's like, we have fever.
Mm-hmm.
So Teresa, I just wanted to ask you, how are you guys addressing that fever in those patients here in the neuro unit?
Well, we definitely use Tylenol,
Okay.
and thankfully here our pharmacist let us use IV Tylenol, which is really nice for the, the ones that are a little bit warmer than the rest. But
Okay.
and then we also use fans, ice packs. And if it's really bad, we'll pull out the water blanket. And we're pretty happy with it.
Okay, with the water blanket.
Uh-huh.
Okay, very good. So, question, what about those patients where you've done Tylenol? And I know you guys are culturing because I saw your protocol. And what about, you put the water blanket? But what about those patients, and it's a small subset, where you're not breaking the fever? You're not breaking it, and it's what we call refractory fever. How are you treating those patients? And again, small subset.
Yeah, that's a good question. I don't really have an answer. I wish I did.
Well, I think I have an answer.
Okay.
So if I may,
Yeah.
just show you this. So what I want you to look at here is, over here on the left-hand side are temperatures. On the bottom is time. So here you see a patient who's, afebrile, and then here, patient is becoming febrile. So what do? The nurses give Tylenol. It's your standing order. Tylenol doesn't work after a couple of hours. You're doing your cultures. You just said you pull out water blanket, you put a little bit of ice in them, pack them in ice. But it's that subset, Teresa, where it becomes uncontrolled.
Right.
And what are your thoughts on this uncontrolled refractory fever in the neuro patients here? What are your thoughts?
Well, it's kind of scary. I mean, I know obviously it's not good. But
And, Dr. Helmer and Janice both agreed it's not good.
Right.
So here's where, when you said don't know what to do, guess what? You have the Arctic Sun next door in the MICU. With the Arctic Sun, Teresa, because it does control the patient's temperature, the fever will be broken, and then you will be able to control that patient's temperature. And here's another way to illustrate exactly what I'm talking about. So you have a patient running 104, whatever your temperature is in here, you're at what? Dr. Helmer says 101, 101.5. He starts treating it. You give Tylenol, you wait a couple of hours, doesn't work, you apply the water blankets. So I'm not saying, Teresa, run and get the Arctic Sun for all the patients. I'm talking about that small subset, that refractory fever. And again, apply the Arctic Sun, and what does it do? It breaks and controls the patient's temperature. The other thing I want to show you, if I may, is I want to show you a case on a patient here in the Houston area that the neurointensivist was using the Arctic Sun. So this is a patient who was admitted into the neuro ICU on September the 4th, 48-year-old male patient. Apparently he was skateboarding, 48 years old, skateboarding, I know, right? And he fell, bumped his head, ended up with a big bleed. EMS was called after the patient fell down and lost consciousness. Had a history of hypertension, juvenile onset diabetes, history of drug and alcohol abuse, and on admission to the ER, he tested positive for marijuana.
Oh, wow.
Patient was intubated, sedated, paralyzed. The Arctic Sun was used. The neurointensivist ordered the Arctic Sun when the patient was febrile, but with the fever, his ICP was going up. And she said she started the Arctic Sun when the patient reached about past 20. When he started hitting 25, she started using the device. They used the Arctic Sun for 96 hours. So I just want to show you the graphs of how the Arctic Sun will control the patient's temperature, and then also in this case control ICP. So on the graph, numbers in yellow are patient's temperature, numbers in blue are device water temperature. At the bottom, you see the legend here, but green means go. This aqua line is flow. And right here, Teresa, you can see the patient's target. So patient came in when they started the device. He was 39.2. That's pretty febrile, right?
Mm-hmm.
But they actually picked a target of 35.5, and the reason was because of the ICP. So she was able to control it. So after 5 hours, she was able to control the ICP. So she changed the target to 36.2. But what I want you to notice here is when the patient is febrile, the water, remember blue is water, it's cold. Patient started to come down. The water temperature started to go up. Here is day 2. We continue therapy. And you can see, Teresa, that when the patient's febrile, the water's cold. If the patient goes below target, the water warms up. But throughout these days, and it was actually like 4.5 days, here's the patient's temperature. And I want you to notice, too, that when the devices stop in a stop mode, when the nurse hits stop for whatever reason, patient's temperature starts to go up. So there's no control. They resume therapy, we get better control. And here, this patient was just really, really sick, febrile, ICP going up, etc. Again, here, same thing that I'm talking about. So for this particular patient, and this is the last day, but look at the water down here.
Wow, it's cold.
It's very, very cold, and the patient is not even at target.
Yeah.
So what does that tell you? He's still not normal thermic. And actually, this was just a portion of the case that I just wanted to show you. But again, 96 hours. But the point being is that you have the technology here in-house, and, you know, maybe you should think about using it for some of these aggressive refractory.
That's a good idea. I can run that by Dr. Griffin and Ann and see.
Yeah, and Dr. Helmer as well.
Yeah.
But anyway, so listen, I better get over and start teaching the class.
All right, thanks so much.
Thank you, Teresa.